Okay. Oh, it's warm in here. It's warm in here. Oops. Sorry. Oh, I should have brought new collars for you guys. Okay. All right. Thanks, Richard, for CCing. I have an update on Harriet's ultrasound. If you remember, quite a few weeks ago during their first exams at Harriet's checkup, they heard a heart murmur. So we were waiting until her spay to see if the heart murmur still existed or if maybe it was stress induced. We were, of course, hoping it was just because she was anxious at the vet. But at her pre-surgical checkup before her spay, they still heard the heart murmur. It's around a grade 2, which is not very high. Heart murmurs go from grade 1, which is the most minor heart murmur, up through grade 6, which is the worst. So grade 2 is not very loud, but the volume of a heart murmur, so the grade of it, does not necessarily correlate to the severity of the heart condition. So we had an ultrasound done, and several doctors actually took a look at it at Del Val because it's a little mysterious. She does have an enlarged heart, so the ultrasound clearly shows that her heart is not normal. So this is not just something that's caused by stress or anxiety. You know, she does actually have a structurally deformed heart in some way. It's not HCM, which is the most common heart disease, which is the thickening of the walls and things like that. Hydrotrophic cardiomyopathy or something like that, cardiomyopathy. It's shortened to HCM. So they could deduce that it's not HCM, but they could not say what it is. So, so the best that we could get from the primary vet, who are not experts, and from only having the ultrasound, is that the structure of her heart is not normal. There is some evidence that there's a defect. It's not HCM, but they can't say what it is. And that, you know, as of right now, it's a grade 2 murmur. So they recommended the next step is to see a cardiologist who may want to do additional testing. Historically, we've had kittens see the cardiologist to have an echocardiogram or, you know, some other type of diagnostics, but that's their recommendation as far as next steps. A cardiologist might suggest medication or some other form of treatment, or, you know, might say that's not necessary at this time, but the vets at Del Val were not able to address whether she'll need medication, whether there's any shortening of her lifespan. You know, they couldn't answer any of those questions. And so this isn't the news we were hoping for. You know, of course we were hoping for Harriet to just have stress-induced a stress-induced murmur that goes away once she comes home and she's settled, but that doesn't seem to be the case. So I spoke with her adopter just now, and it's a little complicated because the adopter has had 2 previous cats in the last bunch of years, and both of them had some serious health problems that shortened their lifespan and shortened it quite a bit. And so the adopter, understandably, her only requirement in the adoption application that she wrote was that she wanted a healthy cat. You know, she understands obviously that, like, with age, you know, there might be health conditions that come up, but she just wanted to start with a healthy cat. Just, you know, her experience has been that she's only had cats who were really sick and had medical problems, and it's been a lot of heartbreak losing them early. And so, you know, she really wanted to just start on the right foot and have a young cat who would hopefully have many, many years with her. And it's very understandable, right? That, like, that's what she was hoping for. It was really her only requirement. You know, she wasn't particular necessarily about what the cat looked like, or you know, how old she was and that sort of thing. Like, she was very open to lots of different options. And, you know, her one requirement was that that she found a healthy cat. So this is certainly really difficult for her. And sort of what we're going to do next is a little bit up in the air. So we had agreed, when I did approve her, we had agreed that pending her checkup at her spay, we were going to move forward with the adoption. But if something had come back where it was detected that she did have a heart condition, we would need to reevaluate the adoption. And that's where we are right now. So so the adopter is first taking some time to think about this, you know, maybe a day or two to just talk it out with some friends or family and just sort of think about it. And 2, to discuss with her own vet, and possibly, you know, her vet speaking with a cardiologist. It's kind of like Red Bank, where she takes her cats, where they have primary vets, but they also have many, many specialty vets, cardiologists, neurologists, all that sort of thing. So, so she's going to get the ultrasound from Del Val, get that to her vet, have her vet look at it, maybe be able to discuss that with a cardiologist there, and just sort of get an impression on what this could be, how severe it could be, what it sort of means prognosis wise. So so all that's to say, you know, as of right now, you know, we are unsure whether Harriet will be still heading home on Monday. There are some different outcomes that might happen. We might keep her longer here and actually have her see one of our cardiologists, have diagnostics done with our vet, and hopefully come up with a diagnosis, which then at that point we'll rediscuss it with this adopter. So she would just stay with us longer while we do those diagnostics, or you know, she might head home with the adopter and then get further diagnostics through her own cardiologist, which we would likely cover as we do with any adopted cat, when you know, we haven't fully diagnosed a cat at the time that they're adopted. You know, we cover anything, any kind of, think of it as like pre-existing condition, you know, we cover up front. So those are sort of the options on the table. I might not know for a couple days, but the adopter and I are going to stay in close touch. So, you know, I might have different updates as we go. But that's sort of where we are right now. So not the best news. I can see why the doctors, you know, had to take a little longer to get back to me to discuss the ultrasound, because they themselves wanted to talk together, and the owner of Del Val got involved and took a look at the ultrasound, because it is an unusual sort of condition that she has. You know, it's not obvious what it might be. So thank you for being patient as we sort of you know, figure out whether she's still going to go home on Monday or not. It might be some last minute changes. Might need to rearrange some of the schedule, but we'll see. Anybody have any questions? Look at these babies. Look at these babies. I'm gonna clip this in case anyone misses it. I think it'll be easier to explain if people are able to hear me talk about it versus trying to explain it in chat. So yeah, there's Nutty trying to come up with a PSA in 200 characters. I think that's going to be hard. So hopefully, you know, of course it'll be on DVR, but I'll also clip it so that people can take a quick view in case anybody misses it. So that's all for now. Thanks, Richard, for CCing. Thanks for jumping in. Great job. Oh my gosh. You can stop CCing. I'm just going to talk to the kittens now because they're so cute. You kids are so cute. Sleepy boy. Sleepy kittens. Babies. There's zero concern about any of the kittens having anything wrong. They didn't hear any kind of heart problems during their checkups. So we don't expect that this was something that she passed down. Harriet has this thing, every time I'm in the room, she seems to poop. So as I was giving my update, she went over, had a big poop, and then went to the door to clean her butt. So that's what she's She's at the door right now, cleaning her butt. Thanks, Edrup. I'm trying to get back into doing updates on cam. I used to do it often, and then I don't know, I just started doing it in chat, but I don't think it's as effective. I think I can explain more out loud than I can in chat. But literally, I think every time I've come in this room, Harriet has pooped. Like, I definitely relax her or something. Thankfully, at least now that all the parasites are gone, the poops are perfecto and it's not a bunch of like stinky mess anymore. So that's good. I'm stuck. I got some sleepy kittens on me. Of course. Where's May? Oh, she's back there. Of course, I got a Zora and Marshall. And I think Kobe. Yep. Kobe at my foot. Okay, kiddos. Here we go. Oh my gosh. Oh, buddies. Okay. Oh my gosh. Oh my gosh.